So let's start with some things that we already know. We already know that opioid is rampant in the white community. We know that there has been an increase in it as well as overdoses and basically people dying, white people. We know that white people are trying to push it off into the black community so we can die at a rate that they are because they're dying off pretty quickly. But this notification popped up on my phone from my news app that says new hepatitis C infections triple due to opioid epidemic. Now, in case y'all didn't know, hepatitis C can be transmitted through these needles for people who are taking drugs. So when they shoot up, you know, using a needle that someone else has used, they have a greater chance of contracting any kind of disease or whatever that this other person may have. New hepatitis C virus infections in the United States nearly tripled between the years 2010 and 2015. The number of new nationally reported infections with the virus swelled from 850 in 2010 to 2,436 cases in 2015, with the highest rates among young people, mainly 20 to 29 years old, who inject drugs. However, the CDC, Centers for Disease Control and Prevention, estimates the true number is much higher, about 34,000 new infections nationally for 2015, since hepatitis C has few symptoms and most newly infected people do not get diagnosed. Mainly because these people are too high and fucked up on these drugs that of course they wouldn't notice these symptoms. They would think whatever they're experiencing it comes along with the high. An estimated 3.5 million people, mainly baby boomers, in the United States currently have an infection with hepatitis C, which damages the liver. Symptoms can include fever, abdominal pain, loss of appetite, nausea, vomiting, joint pain, and jaundice. Last year, the agency reported a recorded number of fatalities from the virus occurred in 2014. Recent CDC research has identified increasing injection drug use tied to the U.S. opioid epidemic in rural and suburban areas across the country. Dr. John Ward said hardest hit areas in terms of new infections are parts of Appalachia and rural areas of the Midwest and New England. Rural areas in other states are also experiencing a similar, though smaller, rise in new hepatitis C cases. 7 states, Indiana, Kentucky, Maine, Massachusetts, New Mexico, Tennessee, and West Virginia, have rates at least twice the national average. In addition, 10 states have rates above the national average: Alabama, Montana, New Jersey, North Carolina, Ohio, Oklahoma, Pennsylvania, Utah, Washington, and Wisconsin. Mainly, if you notice that these are white states. These new infections are most frequently among young people who transition from taking prescription pills to injecting heroin, which has become cheaper and more easily available in some cases. In turn, most in some communities, people who inject drugs become infected with hepatitis C. And it's not just hepatitis C, it's also AIDS and whatever other kind of viruses that these people may be carrying. Hepatitis C, a blood-borne virus, has primarily been transmitted from person to person via shared needles since the early 1990s, when donated blood screening and other precautions were put into place to prevent healthcare-related spread. Much less frequently, hepatitis C is also transmitted through sexual contact or during pregnancy between a mother and baby. There is no vaccine for hepatitis C. The best way to prevent hepatitis C is by avoiding behaviors that can spread the disease. Now, honestly, let's be real. Are these white people really going to avoid any of these kind of activities where hepatitis C can be transmitted? I think not. At the rate that they're dying off, at the rate that they're overdosing on all these drugs, I highly doubt that. Ward and his colleagues believe states can reduce the number of people risking a hepatitis C infection by adopting laws and policies that would increase access for IV drug users to services intended to prevent and treat the infection. For the new report, then, Ward and his colleagues assessed state laws and Medicaid policies that impact IV drug users to decide whether a state had comprehensive needle laws. And the thing is, like, it's not even the fact of having needle laws, but I mean, you have people who do drugs who aren't getting it from a hospital. You can get needles from anywhere. I mean, you can buy them from the store. You can get them offline. So the fact that they're trying to implicate needle laws, I don't think that's going to work. That's not going to stop somebody who really wants to get high, especially someone who is an addict. The CDC explored 5 questions. Did the state explicitly authorize a needle exchange program? Did the state exempt syringes from the definition of drug paraphernalia? Did the state decriminalize possession and distribution of needles for participants of needle exchange programs? Did the state permit a person to disclose possession of a needle to an arresting officer to avoid criminal prosecution? And finally, did the state allow the sale of needles without prescriptions to injected drug users? How do you know that these people are injected drug users unless they've been arrested and that's put into their file? You have people who have no criminal record who are on drugs. So how can you sit here and say, oh, did the state allow the sale of needles to injected drug users? Come on now. With regard to Medicaid, the researchers looked at whether a state imposed sobriety requirements on drug users before approving treatment for an infection. Permissive Medicaid treatment policies, as defined by the CDC, would mean states either do not require a period of being sober or only require screening and counseling for a person to receive treatment. The CDC found 3 states, Massachusetts, New Mexico, and Washington, with both comprehensive laws and permissive Medicaid policies capable of improving access to preventative and treatment services for injected drug users. I'm not going to read the rest of the article. I'm going to leave it in the description. But it goes on to talk about hepatitis being transmitted between a mother and child. But my thing is like, who cares? Let it continue. Let them die.